And I would want us to, listen, relax, and enjoy as I hand over to Dr. Omotayo to take on from here. Dr. Omotayo, are you there?
Yes, I am.
Oh, okay. So I'll be handing over to Dr. Omotayo. Kindly introduce yourself, ma'am, so everybody can know you before you proceed.
Thank you very much.
Yes, ma'am.
As said before, I am Ayeni Omotayo. I'm a medical doctor. I specialized in obstetrics and gynecology, and my subspecialty is fetal-maternal medicine. I also have special interest and training in reproductive endocrinology and benign gynecological conditions, especially uterine fibroids. I'm currently the head of department for Ops and Gynae, Lagoon Hospitals, where I work. So today we'll be discussing what to do and know before getting pregnant. The act of procreation is very, very important because it determines the continuation of the human race. The type of people, both in genetic and biological components that exist in the world, determines the survival of the human species. So pregnancy is a condition that should not be entered into with levity, but must be adequate preparation must be made before getting pregnant. Also, we have the psychological aspect of pregnancy. People have postpartum depression, blues after delivery, and a lot of people are not just ready for pregnancy before they enter into pregnancy. And the outcome of pregnancy actually depends on these pre-existing conditions that can affect the outcome of the pregnancy. If the baby is going to be good or alive, or if the mother is going to be safe and alive. And about more greater than 60% of pregnancies have been found to be unplanned. Most pregnancies are unplanned for. So a lot of people just discover that they are pregnant. And the biological and genetic inheritance for that baby, the parents contribute significantly to it. So getting yourself ready before getting pregnant is very, very important to have a good pregnancy outcome. So that takes us to preconceptional care. So what is preconceptional care? Pre, that is prior or before. Conception is pregnancy. Care, management. So it is the care that is given to all women in the reproductive age group. And we talk of reproductive age group for women between the ages of 15 to 49 years. Before they get pregnant, to identify. Then when we have identified these conditions, modify them, and also treat them. These are pre-existing medical conditions, mental conditions, and social conditions that may affect pregnancy outcome. You'll be thinking about, you may know about the medical conditions, hypertension, diabetes, asthma, seizures, kidney diseases, mental disorders, people who have bipolar disorders, people who have depression, social issues, people who have domestic violence, people who have abuse in one form or the other, people who are alcoholic, people who are on substance abuse, all these things affect pregnancy outcome. We also talk about social issues. We talk about age. Extremes of age, very important in pregnancy outcome. Less than 19 years. Pregnancy less than 19 years is full of issues. Any pregnancy more than 35 years is even full of issues. The chances of even getting pregnant after the age of 35 years is significantly reduced. So you must be aware of all these factors. Now, why are we talking about this thing? Why is this so important that we have to sit down today and be listening to this lecture? This is because having a preconceptional care, knowing what to do before actually getting pregnant and making sure that it is done and you are fine, improves pregnancy outcome, improves women's health, helps to attain the sustainable development goals in general, and that one prevents diseases and management of factors that leads to either the death of the baby or the mother in pregnancy. So what are these components we are talking about? We talk about risk assessment. Risk assessment is looking at factors in the mother or the father, or the two of them combined, that can affect the outcome of this pregnancy in a bad way. The way we have assessed this risk, we do health promotion. Health promotion is one of the things we are doing today, educating the populace, making sure people are aware of it. Then when we have done that, we now do medical interventions. Don't forget that we are not just going to identify, we are going to modify, which is the health promotion. We are now going to treat the medical intervention, and also we are going to address the psychosocial interventions. For people who are alcoholic, for people who have one issue or the other, substance abuse, people who have domestic abuse, we are going to address those issues so that there can be a good pregnancy outcome. Now, what are we looking for in risk assessment? The medical history. The health history. Is the woman hypertensive? Is she diabetic? Does she have systemic erythematosus? Does she have any underlying thyroid dysfunction? Does she have cancers? Does she have kidney failure, liver failure? Because there are some cancers that you cannot even get pregnant with to end the life of the woman. The age of the woman. Is the age safe? If you're more than 35 years, you know that chances of getting pregnant is really, really reduced. And a lot of people don't know. A lot of women will get pregnant at 40 and be asking me, Dr. Ayeni, I'm not getting pregnant. Fertility reduces with age because you are born with predetermined number of eggs. And from the moment you are born, this eggs reduces in quantity. And by the age of 35 years, there's almost decline in everything. So you look at psychosocial history. I've talked about domestic abuse. Does your husband beat the woman? Has she even lost pregnancies because of beating? Sexual history, because of sexually transmitted infections, because of some viral infections that can cause abnormal pregnancies that just make the head of the baby to be small, like the one we call the touches group of drugs. That's the head of the baby. We talk of rubella, we talk of cytomegalovirus, we talk of the herpes virus. Those kind of things, they reduce, they can cause a bad pregnancy outcome. The drug history, is the person on hard drugs? Does the person smoke? Does the person drink? The medical history, is the person, there's some hypertensive that are not safe for you to conceive. So when you are pregnant, there are some medications that may not even allow you to conceive. So you have to be sure, if you want to get pregnant and you have those conditions, can you even get pregnant with that? Then the family history, genetic history. Do these people, do your family, do they have issues? They don't have congenital abnormalities in the family, diseases, so that you know if you're going to go for screening or not. There's some people that they carry the genes for cancers. So you have to know when to get pregnant, don't delay. That early pregnancy and breastfeeding your children, especially breast cancers, can actually reduce the risk for you, as well as ovarian cancers. Then occupational history, where the person works. The people work in an environment that exposes their organs to cancer formation, that there will be cancer formation. So you have to know, look at the occupation and be sure that it's not going to expose the parents to having an abnormal baby. Look at that one talks of the environment. After we have taken the issue, we examine, we check the weights, we check the heights, we check the blood pressure, we check the pulse rate, we check everything that we need to check to be sure that obesity has been associated with a bad pregnancy outcome. So, it increases the risk to have so many things. So you want to be sure so that you can control your weight before you get pregnant. Physical examination too, we want to focus on that. We also want to do some laboratory tests. Want to check your blood sugar, want to check your blood pressure, you want to run some tests, especially if the woman has issues even before getting pregnant. Then you want to do nutritional assessment, because there are some weights that the woman will not get pregnant. If you are too overweight, you will not get pregnant easily. If you are underweight, you may not get pregnant easily. And the course of the pregnancy may also be affected by the weight of the woman. So then we go to health promotion. What do we do in health promotion? We offer counseling. We counsel you concerning the health condition that has been recognized and how to go about it. And know if getting pregnant is safe. And when to also to get pregnant, We also offer you folic acid. Why is folic acid important? It has been found that people who have a baby that has formal abnormality, or people who have recurrent miscarriages, or people who are old, that may have their chromosome has been damaged or the other. If that's the job of the folic acid, it repairs the chromosomes. It repairs these cells so that it can be good quality, so you can have a good quality baby. However, you need to be very cautious in using folic acid if you have issue of fibroids, because the folic acid may make fibroids to become very big, that you may even need to have a surgery when it is given. So you must see a doctor who must be able to evaluate you and know the dosage to give to you. Because the commonly available one, which is 5 milligram, is reserved for just a specific group of people. Then I've talked about the screening and counseling if you have the risk of having an abnormality in your baby, maybe vitiligo runs in the family, or albinism, or some conditions that can even be leader, that the baby dies before they even give you. That predisposes the woman to having recurrent miscarriages. You need to go for screening and counseling. For people who are malnourished, they need to go for dietary and nutritional counseling, and guidance before you can actually get pregnant. There's some people who have systemic lupus erythematosus, I'm sure you've read about an actress, a lot of people have the condition, they even still get pregnant, but you must be, they have the risk of having recurrent miscarriages. So those kind of women may benefit from molecular weight heparin and also some medications that will help them. And also a group of women can also benefit from taking what we call baby aspirin. I'm sure you've heard about it a lot before. So it reduces, having abnormal babies in pregnancy or having recurrent pregnancies. Now let's go to lifestyle modification. There are some conditions that can be modified. There are some that cannot be modified. You cannot modify your age. You cannot modify your genetic composition. You cannot modify your gender. All those things cannot be modified, but they can be assessed to give a good outcome. Well, the conditions that we can modify include the weight, it includes the nutrition, the medications that you are taking. I've talked about that not all medications are safe in pregnancy. Substance abuse, it can also, you need to go for rehabilitation. You withdraw before you get pregnant, because you can make it to have an abnormal baby, autism, attention deficits, babies. Also, people who take alcohol, there's what we call fetal alcohol syndrome. That it just spoils the baby for you and gives you an abnormal baby. Tobacco, smoking gives recurrent miscarriages. And there are some vaccinations that are even important before you get pregnant, because the only vaccinations that are safe in pregnancy are the ones that are passive, the ones that are not active. And when we are talking about this cytomegalovirus, rubella, Touches group, You can't take the vaccination in pregnancy. They are active vaccinations. But when you take them before you get pregnant, you are free from getting a baby that may be affected by it. I've had a baby, a woman who's currently pregnant in my clinic now. She has had 2 babies who have rubella syndrome, and it's very small. They have the retardation. But when she came again, we were able to evaluate her, discover the cause of the problem. We treated her, and she's carrying a normal baby now. So, let's look at medical interventions. Diabetes mellitus. There's a need for proper control of the blood sugar before the woman gets pregnant. This is because excessively high blood sugar not only can it make the woman to have miscarriages, can also make the baby to die inside, as well as give the babies abnormalities when the baby comes out. Some babies may not even affect and showing when they are young. Some people even have the type 1 diabetes. Some babies have congenital abnormality in the heart. That when they are now old, they'll say, oh, they have heart disease. They talk of heart block. No, it is this diabetes that can affect such babies. We have talked about hypertensive disorders. It's one of the commonest causes of women dying in pregnancy now. So you must be well controlled when the woman gets pregnant. And even when she gets pregnant, there are some drugs that aspirin that I talked about, that she must be placed on so she can have a good pregnancy outcome. There are some cardiac diseases that are not compatible with pregnancy, that the woman will be advised, don't get pregnant. If she gets pregnant with them, she's dead, So those pregnant, when they get pregnant, they even terminate the pregnancy. So you must know. And there's some that are safe, they are compatible with getting pregnant. But you must be stable before you say you want to achieve pregnancy. Thyroid disorders, it can affect the babies. Epilepsy. So you need to be it needs to be well controlled. HIV infection, we know that HIV, the viral load and the CD4 count, which is the level of immunity, is very important for the woman not to transfer the infection to the baby. So the woman must be well managed, the viral load must be very low, the CD4 count must be very high before the woman attempts to get pregnant, so that she will not transfer HIV to the woman, to the baby, so the baby will not spend the rest of his or her life taking antiretroviral drugs. And we know that HIV is even beyond taking these drugs. Some people, they take their drugs religiously, but they still have the after effects of having this HIV. So it is worth not even transferring to the baby at all. So we also talk about uterine fibroids. Many people go around with fibroids, nothing happens to them. But a lot of women have fibroids that must be taken care of before they get pregnant. So such women needs to go to the hospital, so to be properly evaluated, counseled appropriately, so they can have their babies on time. And some people get pregnant with fibroid, and the fibroid will now endanger their lives. Some people may even lose their lives in the course of giving birth to a baby because they have fibroids. So you need proper evaluation before you attempt pregnancy. I've talked about other conditions, the SLE. People who have tendency to form blood clots, they can just die in pregnancy if it's not well managed, because they can just throw blood clots to the lungs, and that one will block their bleeding. Some other conditions, the woman cannot even get pregnant. So you must know before you get pregnant, and the pregnancy will not take the life of the woman. Sickle cell diseases, pregnancy worsens the outcome. In fact, a lot of sickles is in pregnancy that kills them. You have to be sure that you can get pregnant. I've talked about cancers. I've talked about the rubella. That's the touches group of diseases, to know if the woman can get pregnant or not. Now, what do we stand to gain? Why should you do it? After all, you've been getting pregnant before, and nothing has happened. So if you now do it this time around, what do you benefit? Each pregnancy is peculiar. You don't know the outcome of anyone. I've had a patient, in fact, she just delivered 2 weeks ago, who has had 3 fantastic babies, and she had 3 babies that died inside her because she had one of these touches group, these viruses I was talking about, and she did not know. And the babies were just dying. until we have to screen her and find out why these babies are dying. And she has delivered 3 healthy babies. So it prevents birth defects, reduces miscarriages, reduces preterm delivery. I mean, prematurity has its own problems. Reduce the mother needing to die in pregnancy just because she wants to procreate, she wants to give birth to a baby to the world. Women don't need to die. So if a woman is evaluated properly to identify what can kill her in pregnancy, it will reduce the rate at which women die. Also reduce babies that will be born into this world and just die to the family of such babies. So where can you get help for this preconceptional care? Who runs the clinic? Where do you go? Oh, fine, you've talked to us about it. Where do we go? Health assessment units, primary health care centers, mother and child hospitals, adolescent clinics, early pregnancy units, that they call it EPU, general outpatient clinics. Just tell the doctor, oh, I want to get pregnant. I have so and so concern. I'm sure they know what to do for you. Who runs these clinics? Who offers this care? Multidisciplinary approach. All form of doctors, endocrinologists, cardiologists, nephrologists. It's not only gynecologists. Every doctor that has their specialty is the one that concerns your condition. They are involved. Nurses, they offer the counseling, they check the vitals, parameters, and know which doctor you are supposed to see. They are able to pick all these tests in running the initial assessments for you. Healthcare workers. So, in conclusion, we know that the essence of preparation of in every life's endeavor determines the outcome. When you prepare very well for an exam, you pass exceedingly. But when you don't prepare, you know that it is failure. So when we are talking about procreation to continue human race and our generation, we shouldn't take it lightly and we shouldn't handle it carelessly. A healthy child that is alive and a safe mother that is also alive is the success of every pregnancy. And that is what we should look forward to. So thank you, everybody, for listening.
Thank you so much, Dr. Omotayo. That was such a very interesting presentation. That was remarkable. I loved how you were giving us the facial expression, your gestures. I just had to be glued to my screen because I needed to listen, right? So I hope every one of us enjoyed this. I hope we have learned a thing or two, and I would want us to ask our questions. So we have our first question. Okay, so somebody is asking, that's from Comfort Nuhu, and she wants to know the causes of ear problem and pains in pregnancy. She's asking for the causes. What are the causes of ear problems and pain in pregnancy? Did you get that, Dr. Omotayo?
So causes of ear problems and aches in pregnancy may be a pre-existing condition that you have had. Maybe because you have infection. It may be that the eardrum is perforated. It may mean that be because you have a foreign body in that place. The right people to see are the ear, nose, and throat doctors. They call them the ENT surgeons. They would ask questions. They have instruments that they use to look inside your eardrum, look inside your hair, take part of that discharge, subject it to test, look if there's foreign body, look at all the structures that are there, and be able to manage you appropriately. Pregnancy on itself does not cause ear problem in pregnancy. So it's either you have a pre-existing condition or a condition that just happened to you in pregnancy that caused the ear infection. So the doctors that are appropriate to see her will be the ear, nose, and throat doctors. Thank you.
And I have an additional question from someone who asked before from Facebook. The person who asked about protein in urine during pregnancy. So the person said, in case a woman that suffered preeclampsia in pregnancy, okay, in the case of a woman that suffered preeclampsia in pregnancy, and after giving birth, the blood pressure refuses to normalize, what is she going to do about it? And she's always on her medication. Did you get that?
Then that means the Lord, yes, I heard that. Then they have not gotten the management right.
Okay.
Unless there's a chronic kidney disease. If there's no chronic kidney disease, there are medications to control the blood pressure. They just need to give the right quantity and the right amount. That is the work of the cardiologist. So that is why you need to see a cardiologist to control the blood pressure. It's not that the obstetrician cannot control it, but that's why they call this a multidisciplinary approach. The book says you are supposed to work with the cardiologist to control the blood pressure, to give drugs that are safe for breastfeeding. So please, you need to see a cardiologist. There's nothing like the blood pressure cannot be controlled. The blood pressure can be controlled. If the blood pressure cannot be controlled, then there's a kidney problem. So they need to investigate you, examine you, and find out which one they are managing you for and manage it appropriately. All the conditions can be managed. So please see cardiologist, let the cardiologist evaluate you, give you the appropriate medications in the appropriate dosages, and the blood pressure will be controlled. If the blood pressure is not controlled, they will know the reason why it's not getting controlled, not just assume that you're not controlled. So if it's not getting controlled where you are, then you need to see another doctor. You need a second opinion.
Wow, okay, ma'am. So I just want to ask, what do you mean by the blood pressure being controlled? Are you saying it has to get back to be within the normal range, or moderate or mildly high?
Blood pressure control is a blood pressure that is less than 140/90. Any blood pressure that is greater than 140/90, that is not in a particular age group, that is an older age group, maybe in the 70s, then there's a problem. But even universally, the definition of high blood pressure is blood pressure greater than 140/90. So if it's not, if it's still greater than 140/90, there is a problem.
Okay.
So that means, but for us to determine if it's actually normal or it is actually high, she needs to see a cardiologist. They are the ones that manage that condition perfectly. And there's a reason why they manage that condition. They will check the heart, they will check the readings of the heart, they will know what to do to prevent stroke, they will know what to do to prevent heart failure, they will know what to do to prevent the muscles of the heart getting bad, that we call the ischemic heart diseases. So they know what to do. And that is why everybody is subspecialized to know how to manage that condition very well. Don't assume that every doctor knows everything. So go to the cardiologist, let them manage it.
Yeah. Thank you, ma'am. So I think such questions would come from a person who has actually been checking her blood pressure. So for those of us who have not been checking, I think this is our cue. Let's ensure to check our BP so we can know the right questions to ask. And I think I've learned something today. Any blood pressure that falls from 140/90 and above is high. So if you haven't checked, please, you need to check. If it falls above 140/90, please, you need to consult your doctor. That's if you're not already on medications.